I'd like to welcome you to this short video where we'll be talking about lower back strengthening exercises. Our goal is to provide you with an overview of the specific treatment methods we use to identify and treat the cause of the problem, not just the symptoms. In approaching back pain treatment in this fashion, we help you maintain activity and integrate that activity into your normal lifestyle. So, with that brief introduction, let's take a look at the components of what we call our functional spinal rehabilitation program. In this program, we integrate the following components. The first component is a targeted medical exercise training program. Now, what that specifically means is that we only choose exercises that are meant for your particular condition. In other words, if you have particular muscle imbalances where you have specific muscle tightness and specific muscle weakness, we only have exercises that are targeted towards those flexibility deficits, the tightness in the muscles, and the weakness. It doesn't make any sense to give you exercises that don't address the specific problem. The next component is that we attempt to reestablish proper segmental sequencing and mobility. When we move in a coordinated fashion. And with respect to the spine, the vertebrae move from the top down, typically. So when you're doing a functional activity and we're trying to restore that mobility, we want to reestablish that timing and the proper sequencing of that mobility so that you can achieve the things that you do. So that's a very important component that we're doing. The next thing that we do is that we're going to incorporate tissue relaxation. These are stretching activities. These are activities to promote relaxation. Many times following a back pain episode, the muscles will go into what is oftentimes referred to as spasm, so that the muscles become very, very tight. There needs to be some specific activities to address that tightness, and sometimes flexibility, it can't be the only thing that we use. Flexibility exercises, that is, can't be the only thing that we use. We need to sometimes utilize other alternative means of relaxation. One of those may be diaphragmatic breathing. That's an exercise that we often prescribe with patients with lower back pain. The next component is the normalization of the neuromuscular reeducation. We want to normalize the neuromuscular system. Now, this is extremely important because we have to reprogram how these muscles function. Many times, the muscles lose their ability to function normally, and that is not just a component of the muscular system, but a component of reintegrating the nervous system back into those muscles. So there's some techniques that we utilize and exercises that we utilize to do that. And then the last component is that we want to restore dynamic stabilization. So we're going to incorporate these dynamic stabilizing exercises to restore normal function. Our total goal, our ultimate goal, is to get you functioning in the fashion that you were accustomed to prior to the back pain episode. So in the next videos, in fact, we'll have a few videos to follow this one, we're going to show you what the typical injured spine looks like and what we actually do to improve function and decrease pain. So, on behalf of the entire Back Pain Relief Systems team, I'd like to thank you for your interest in learning how to better care for your back. In an effort to better understand your specific needs, we'd also like to provide you with a free telephone consultation with one of our healthcare professionals. To arrange your private consultation, simply click the link you see below this video. All good health to you, and we do hope our paths cross soon.